Hi everyone, I'm here today to talk to you about wet to dry dressing changes. I'm just going to explain the procedure and maybe add a few tips in and the purpose for the procedure, and hopefully it will help you in your practice. So to do a wet to dry dressing change, you'll gather your supplies that you need for the wound care. Generally that's gauze, pads, it might also be 2x2s, 4x4s, plain packing gauze, depending on your wound. Whatever's on the order actually is what you'll use. Sometimes it just says wet to dry and it's at your discretion. But for the purposes of this video, it's a very simple wet to dry dressing change. The reason we do wet to dry dressing changes is because usually we'll have a wound that has become infected and has necrotic tissue and it needs to be debrided. And a lot of times we'll end up with a nice, clean, healthy wound bed to then start with wet to dry dressing changes, and that's because you cannot leave a deep wound just covered, or it will have drainage collect in it and form an abscess, and the patient's at risk for an infection. So you'll gather 2 pairs of clean gloves. It's an aseptic procedure, and all of the supplies you'll need. You might also need a extra bag. As an experienced home health nurse, I'll tell you from that perspective because that's where my practice has been. So I would have maybe a Walmart bag or something like that, and after I'm done discarding my old dressing, I'm going to go ahead and put it in the bag I have, but also in another trash bag, so it'll be double bagged for the trash personnel that come to pick up my trash. A lot of areas also require biohazard bags, and they may supply those for you if they know that you have wound care dressings with body fluids on them. So what you'll do first is clean your hands with soap and water or sanitizer, preferably soap and water, and dry them off, and then assemble your supplies. Once you have those assembled, you'll go ahead and put your gloves on, and we're going to remove the old dressing. So when we have our gloves on, we'll go ahead and remove the tape and, pull out the packing, observing for any change in odor, drainage, or amount of drainage that comes out. It should generally be a serosanguinous, clear type drainage. If you have something that is thick, yellow, or has odor to it, that's probably something to be concerned about. Sometimes it can be green too, and that's usually an indicator of Pseudomonas in the wound. Anyway, you'll pull it out, take a good look at it, see the amount of the drainage, the color, the consistency, and remember that for documentation later. At this point, you're going to want to hold your dressings in one hand with your glove on and pull your glove off over to contain that old dressing, and then pull the other one back into that, so it's essentially already double bagged. I would always tie a knot in the end of that and then place that in another trash container with a bag in it, so it will then be double bagged when it goes out for the disposal. At this point, you can clean the wound. You want to go ahead and clean your hands again, soap and water, and dry them, and then put new gloves on. And a lot of times what you'll do is, after checking your order, for this purpose it's going to be a normal saline wet to dry dressing. So I would open my container of 4x4s and pour saline into that little package. It will not leak or come out, and it's a nice little container to use. You can go ahead then and clean out your wound bed. You might have to actually pour saline in the actual wound bed and then use your gauze to clean it out really well. Being careful not to scrub, because that will disturb the granulation tissue in the wound bed. Your wound bed at this point should be like a beefy red appearance with a lot of good granulation on it. That's a great place for those cells to go ahead and multiply and become good skin tissue. It will heal from the bottom up like this in a V shape. For you that are watching, it's more like this, until the edges are well approximated and healed. Okay, so we have a clean wound bed. Now we're going to pack it. When you go to pack the wound, you want to have another set of gloves to keep this as clean a procedure as we can. So you're going to remove your gloves after cleaning, wash your hands, and put another set of gloves on. This is to ensure that the wound bed stays really clean and you're not putting the patient at risk. Okay, so now you're ready to pack it. You want to go ahead and repeat that procedure of pouring the saline into the bag of gauze. Make sure your gauze is non-fraying, or the edges will get caught in the wound bed and be a potential source of infection for the patient. Then, when you go to pack the wound, pull the gauze up out of the bag, I'm assuming we're using 4x4s for this wound, and you squeeze it until it's just moist and there's no water dripping out of it. If the wound is more on the dry side and there's not a lot of drainage, you want it a little more wet. If it's very wet, you want it as dry as possible, but all still damp from that saline and squeezed out completely till there's no drops coming from the bottom. The reason for this is if your drainage changes and there's a lot and your packing is wet, it's just going to sit there and again be a source of infection. So once you have the proper moisture in your packing, you can go ahead and pack it in the wound. Sometimes you'll have to use a sterile Q-tip or cotton-tipped applicator to help you with that. If it's a large wound, you can just pack it in with your fingers, and make sure the edges do not lay over, or the packing does not lay over the edges of your wound. If it does, the edges will become macerated and it won't heal. It's the white mushy, like sometimes when we take a bath or shower and we're in the water too long, it will become very mushy and it won't heal. Now we're ready to cover our wound, and we want to use a ABD pad, or you might use 4 or 5 4x4s or whatever, for whatever size wound you have. Just make sure it's enough that it will wick away the moisture from the inside, including the drainage, and that's what keeps the wound bed dry and aids in good healing. And then you just secure the edges with the tape that you have, and document everything that you saw, including the wound edges. The length, width, and depth of the wound is something that's measured. Usually a protocol is twice a week, but your doctor may have it ordered, or your more often, or your facility may have it ordered at different frequency. So that's how to do a wet to dry dressing. I hope you enjoyed my video, and thanks again. Have a great day. Bye.